Good morning, everyone. My name is Anu Bajit, and today I'll be presenting my project titled Investigating Nutritional Inequality Through Food Purchase Pattern Across London. This project looks at how what people buy in supermarket, specifically their grocery purchases, which can reveal patterns of nutritional inequality across different parts of London. Especially, I'm using a large scale data on food purchases to understand how access to healthy food differs between different neighborhoods. Let me begin with a bit of a background. So, urban population often experience unequal access to healthy food options, and this has a major impact on the public health. In England, more than 60% of the adults are overweight or obese, and poor diets are linked roughly to 64,000 deaths each year. These inequalities are not only about personal choices, they also reflect where people live, what kind of stores are nearby, and what food options they can afford. So, grocery purchasing data gives us a window into these issues because it reflects the individual preferences and the structural access, what is available in someone's local food environment. So, my central research question is how do nutrition related food purchases vary across London, and what do they reveal about the nutritional inequality at their neighborhood level? So, to answer my research question, I have used a dataset called Tesco Grocery 1.0, which contains anonymized transaction records for over 420,000 households across Greater London, which was collected between the year 2015 and 2018. It's an extremely rich dataset because it includes item level details on what people bought, and we can link these purchases to their nutritional contents like the amount of calories, fats, sugars, and proteins, which are averaged over all the items. So importantly, all the data were aggregated by middle layer super output areas, which can be shortly called as MSOAs, which are small neighborhood level zones. This means we can look at average dietary patterns across local communities without identifying any individuals. The next slide is the variable selection rationale. So here I have focused on three main variables that captures different aspects of the diet quality. The first is the fraction of fruit and vegetable purchased, which serves as a positive indicator of a healthy eating. And the second one is the share of calories from the sugar, which reflects less healthy options or the bad health consumption habits. And the third one is a nutrient diversity score, which is based on the concept of entropy, which measures like how varied people's diets are, or how diverse is the purchase patterns, or how diverse is the food that they are purchasing. So together these variables help contrast health versus unhealthy patterns, and gives us a full picture of the nutritional inequality. Now that we have looked at the data and the variables, let's talk about how working with the spatial aspects of this data. In other words, how I mapped it to the geography to uncover patterns across London. So by grouping data at MSOI level, we can compare food purchasing behavior across London neighborhoods. This make it possible to visualize where healthier diets are concentrated and where they're not. For visualization, I've used a choropleth map uh, to show spatial differences, and a technique called T-maps, which groups similar neighborhoods in two-dimensional spaces to reveal different clusters. So here is the first choropleth map showing the nutrient diversity across London. It shows the proportion of entropy of nutrient waste. Entropy is a statistical measure which is used to capture diversity or variety in a distribution. So here the variety of nutrients or the type of foods which is present in the grocery purchasing data. And the darker areas, mostly in the central and the central west London, which represent neighborhood with more diverse diets. As we move outwards to the peripheries, diversity tends to decline. This suggests that the urbanity and the central locations are positively linked with a more balanced diet. which possibly due to better access to supermarkets, fresh foods, higher income levels, etc. We can also prove this by our correlation analysis of the nutrient diversity and the population density. This is the second choropleth map, which is the fruit and vegetable share. This map focuses on the shares of fruits and vegetable purchases. Again, central London and nearby areas show high values. People there tend to buy more fruits and vegetables. Interestingly, a few less dense outer areas also performs well, suggesting that population density alone doesn't determine the diet quality. On the other hand, East and Southeast London show consistently low fruits and vegetable share, which indicates a potential nutritional inequality zone, which can be possibly linked by affordability or the cultural factors which is being affected in those areas. And this is the third choropleth map, which shows the proportion of the sugar. This map flips the patterns. It shows the share of calories coming from the sugar. So high sugar areas are mostly found in the outer London zones, which often corresponds to the lower diversity and the lower fruit and vegetable neighborhoods we just saw in the earlier two maps. So we can see an inverse relationship. Areas that eat less healthy also tend to consume more sugar, which reinforces the spatial inequality in the dietary health. So the next slide is spatial dependence in nutrient diversity. To move beyond visuals, I've tested whether the spatial patterns were statistically significant using Moran's eye, which measures the spatial autocorrelation. The results showed strong positive spatial dependence for both nutrient diversity and income. For nutrient diversity, it came to be 0.657, and for income, the Moran's eye was 0.584, which means that the similar neighborhood tend to cluster together. In simple terms, areas with diverse diets tend to be surrounded by other diverse areas, while low diversity neighborhood cluster together too. This clustering reflects what we might call a nutritional inequality zone, where poor diet quality is spatially concentrated. So to dig deeper, I have used the K-means clustering analysis, which grouped all London neighborhoods into three distinct nutritional clusters, which was based on their average food purchasing pattern. So let's start with the cluster 1, which we can see that the highest nutrient diversity score about 0.73%. And here has the highest fruit and vegetable share around 31%, and also the lowest sugar and ready meal shares. It has a high population density around 9,800 people per square kilometer. These are typically affluent urban areas, places with better access to fresh foods and more varied diet. Then the cluster 2 represents the opposite end of the spectrum. It has the lowest nutrient diversity at around 0.7% and the lowest fruit and vegetable share, which resulted in 23.7%. This cluster also has the highest sugar and ready meal shares and also a lower population density around 4,900 people per square kilometer. On top of that, the average income here is 693 euros per week, which was lower than other clusters. These are largely suburban, lower income areas, and they can be thought of as a nutritional inequality hotspot. And finally, the cluster 3, which falls somewhere in between. The nutrient diversity here is around 0.71%, and here has a moderate fruit and vegetable shares around 26%. The sugar intake is similar to cluster 1, and the highest density overall falls in here about 10,600 people per square kilometer. But here he has the lowest average income around 634 per week. These are transitional neighborhoods, the diverse and busy but with mixed dietary patterns. The k-means clustering was done on the key variable nutrient diversity. So to put it all together, the cluster one, which was the healthy and diverse diet, which has typically higher income, comes in the central region and the densely populated one. The cluster 2, which has the lower diversity, high sugar and ready meal intake, which comes in the suburban and which also has a lower income. Cluster 3, moderate or mixed profiles, has high density but lower income. These clusters confirm that diet quality varies systematically across London, and both income and urban form play major roles in shaping the nutritional inequality. This slide is the regression modeling. I've run a multiple regression model to quantify what factors predict the nutrient diversity. The predictors used were the income, population density, and the cluster memberships. So the model explained 57% of variations in nutrient diversity. Higher income and denser areas corresponding to more diverse and healthier diets. But even after controlling for these factors, the low diversity clusters still had significantly lower diversity, meaning there are additional place-based barriers that income alone cannot explain. The box plot shows the nutrient diversity uh, among different clusters. The next slide is the cross map insights. When we connect all the maps and results, a clear story emerges. The central urban cores generally eat better. They have higher nutrient diversity, more fruits and vegetables, and lower sugar consumption. Suburban zones lag behind, often due to lower income and weaker food access network. Areas with more fruit and vegetable purchase also tend to show more nutrient diversity. Conversely, sugar and ready meal purchases are strong indicators of disadvantaged diets. So, nutritional inequality is very much spatial, shaped by the environment as much as by individual behavior. So, to conclude, the nutritional outcomes in London are not random, they are spatially patterned. Healthy, diverse diet clusters in central and high density and higher income areas. The low diversity, high sugar diets are more common in suburban and the lower income zones. Income and density improve dietary diversity, but environmental context still matters. Spatial analysis tools like Moran's eye and K-means clustering can highlight where interventions are needed most. These findings point towards the need for targeted policy interventions to address the spatial nutritional inequalities. Yeah, there are several directions this research could take. First, simulate policy or intervention scenarios such as adding affordable producer stores to low diversity areas. The second could be studying the temporal trends. For example, how diets changed after 2018 or following specific policy initiatives. The third could be integrate food access and retail data like store density or proximity, etc. Finally, expand the analysis to other regions of the UK to compare urban and rural food environments. These steps would make the findings more useful for public health and more urban plannings. References. Here I have listed some of the key studies and datasets that informed my work, including the Tesco grocery dataset and recent literatures linking food environments with health outcomes. And that brings me to the end of the presentation. Thank you all for listening, and I hope this study has shown how spatial data can provide powerful insights into nutritional inequality.